As we continue to look at the payment reform legislation being debated on Beacon Hill, I wanted to spend a couple minutes looking at the tremendous amount of faith that's placed in bureaucracy or in bureaucrats that will make up this new agencies or divisions or whatever you want to call them as they're outlined in the bills on Beacon Hill. We're talking about changing 18% of our state economy, and we often see the debate in the press about what teeth are given to these agencies if we don't reach our growth targets. But we should step back and actually look at what those agencies, where those bureaucrats are going to be employed, what they look like, and how much it's going to cost to run them. In these bills, they're given a tremendous amount of power to determine not only how we pay for healthcare, but how we deliver it. They're expected to understand the financial solvency that's required for an ACO or an accountable care organization, what must be required in a contract for an accountable care organization, and how collaborative those accountable care organizations have to be with each other. They're also given a robust role in the determination of need process. This is the process by which a medical institution gets the approval to build a new center or even to build onto its hospital. It's certainly a broken process, but this is a very strong determination of need process that could slow innovation, because these agencies are also given the ability to determine what is the next and future round of medical innovation or technology that we'll be allowed to use in the Commonwealth going forward. In the Senate bill alone, there's 154 new appointees to expert committees or panels to help in these processes going forward. But I think it's fair to look back at history. In just 2006, in the reform, there was a healthcare cost and quality council that was set up with great experts sitting on it. But they've really struggled to be able to set up a product to help consumers understand cost and quality and have deep market penetration with those products. So it's fair to raise some questions with these new appointees as well. I think one of the biggest concerns in the bills are the lack of definition and the power given to bureaucrats, told to take appropriate action when something is deemed excessive, or to take action when some excessive consolidation is taking place, or to have this artificial definition when a sufficient amount has taken place they can authorize or approve certain contracts. I think we should be a little wary some of a setup in which these bureaucrats are given the ability to pick winners and losers, in which a tremendous amount of political lobbying will take place, and added cost to the system, and not savings like we're hoping to get out of these bills. Finally, we actually don't know how much these new bureaucracies will cost. The closest thing that we have to compare is the connector, which was created after the 2006 reform. It costs about $30 million to run that agency. No estimate has been put out by the legislature or done internally in the legislature or even by an outside group. So I think we must stop and pause and ask our leaders, how much will this actually cost? How much do we expect it to add to the system to be able to get these savings going forward?